about 20 years ago, I had a car accident. And from the car accident, I had fractured my foot, but nobody really picked it up. And the pain was getting worse. I went from doctor to doctor trying to figure out why I had pain. I had scans, I had x-rays, nobody could help me. 2 years later, I was diagnosed with reflex sympathetic dystrophy, otherwise known as RSD. My choices with RSD are we just try to treat the symptoms. There is no cure, and the main symptom is pain. So we try everything we can with pain. We go through all the narcotics, all other types of pills or medicine that help with the pain. It's nerve pain. It's a burning pain. But with RSD comes tremors. Tremors cause pain. It's all from the nerves. Prior to the medications, they have tried surgeries. The surgeries were to take out nerves, one by one, but it was just getting worse. And with my case, the nerves got so bad, it caused a circulation problem, caused so much pain, where they actually were going to amputate the foot. That's where the RSD was. And they did a surgery called a sympathectomy, which saved the foot, reduced the pain, but over the years, the pain gets worse. My best pain level, if you rate it on a scale of 1 to 10, the best I could ever get was a 5, and that was with medication. My pain levels go 10 plus, where you just want to come out of your body. You just don't know what to do anymore. It's a burning pain, it's a stabbing pain. If you put your hand over a fire, that's the kind of pain you have, and that's what I live with. With my relationships, they pretty much went south. I had to cancel activities, and my friends, they didn't know how to handle me. I think because they didn't understand the disease, and my social life just was non-existent. Non-existent for one, I didn't have people to do things with, and two, my body couldn't handle it. I found Dr. Pyles through my pain doctor. My pain doctor, Dr. Eduardo Cruz, through Ocala Family Medical Center. He has tried everything for the past 2 years, and he told me that he thinks I was a really good candidate for the spinal cord stem. And he, in fact, did the trial, and he said if the trial works or you get 50% or more relief, then he'll send me to Dr. Stephen Pyles. So we did that, and I did have the 4 or 5 day trial, and it was like the first time I ever had any kind of relief. So it brought my pain from a 10 plus down to about an 8 or 7, but that was so good for me. Well, now my life is much better. I can go out more. I feel up to going out more. What I do now is I make plans. Now, I might have to cancel at last minute, but I make plans. Before this, I couldn't even make plans. That's how bad it was. Now, I do make my plans, and usually I can make the plans. I still, as I said, I still have the pain, but it is much better. I feel better overall, so I'm more positive about things now, so my relationships are better. Plus people understand it, and the people here in Ocala who I've become friends with, they saw me prior to this, and now they see me now, and they can tell that I'm different. I highly recommend a doctor like Dr. Stephen Pyles here in Ocala. He is very artistic when it comes to his incisions. He can pinpoint the spot. When you discuss things with him, he hits it right on the nail. So I would highly recommend Dr. Stephen Pyles.